Dr. Vic Goradia, and I'd like to share this case with you about a young college male that has a cartilage defect behind his kneecap and has continued to have pain, where we're going to go in and transplant some cartilage into the area. This is the MRI scan where the arrow is pointing to the cartilage defect behind the kneecap. The dark area is where the cartilage is worn down all the way to bone. This is what it looks like arthroscopically with the kneecap on the top, and we have this probe that shows how soft the cartilage is, and the probe goes into the cartilage all the way down to bone. This is what it looks like once we've cleaned out the cartilage, and now we have a little template that we're using to measure the actual defect so that we can cut that area for the cartilage transplant. We've placed some little holes in there with anchors that we're using some sutures to pass through the cartilage. This is the cartilage transplant that we've sutured down in place. And now we're going to place some surgical glue into the area to fully seal it. And this gives us the final result of the cartilage transplantation.